So, ladies and gentlemen, my name is Sharon Whiteman, and it's a great privilege and pleasure to be here every week with Diana and Gary. And each and every one of you, whether you're listening live today on a Saturday morning or later down the track. We're so lucky to have Dr. Nugent in our community, fearless leader in the science and wellness side of things for us. And he always says yes when he can fit it into his busy schedule. Dr. Steve Nugent is Mantech's Chief Science Officer and Chairman of the Global Scientific Advisory Board. He has more than 40 years of experience in the area of integrative medicine. He has tested more than 6,000 dietary supplement products and formulated more than 100. He is internationally recognized as an expert in his field, and he's been teaching doctors for more than 30 years. He is Mantech's most requested speaker worldwide. He's earned multiple degrees, graduating with top honors at both the undergraduate and graduate levels. His areas of study include integrative medicine, health and wellness psychology, leadership psychology, organizational psychology, neuropsychology, biological anthropology, nutrition science, and business administration. Dr. Nugent has served as president of the International Association of Complementary Medicine and is president emeritus of the American Naturopathic Medical Association. He is a professional member of the American College of Nutrition, and he was awarded the Servant's Heart Award by Mantech Associates in 2007. He's one of Australasia's favorites. He carries the heart for the health, well-being, and education of all he meets. And I think one of the things that's most important to me is that he's just so passionate about handing to us the power of wellness, into our own hands again. We have far more power to improve our well-being than we're being led to believe. So this education is invaluable. Dr. Nugent, thank you for always being available to us.
Oh, it's my pleasure. I wish I could be there with you physically.
Yeah, we do too. So I'm going to pop off camera, but I'm here if anything goes wrong.
All righty. Well, good morning, everyone. It's good to be back with you again this morning. I hope we have some new folks on board as well. I've been asked to do a presentation for Australia's Women's Health Week. We did one on Men's Health Week, and there'll be a little bit of overlap because if I talk about the differences, say, in nutrient balance between men and women, well, I'm going to be talking about men and women. So, but there's a lot of new information as well. And we'll get into some products towards the end of the presentation to support women's health. For some of you, it won't be any big surprise which ones I recommend. And I don't know, maybe for some of you it might be. So I'm going to do the share screen, and hopefully we'll. There we are. Okay, there I am. All right. Well, globally, the majority of people who buy dietary supplements around this planet are women, and that would be women over the age of 40. So obviously, a discussion of nutrition is going to be of particular interest, whether we're talking about women's health or not, to women in general. Now, here's a glance at the primary differences between males and females. Some of these are obvious to people, some of them are not. Many people don't realize, as an example, and I did talk in a previous talk for this group about differences in brain mass, brain structure, and so on. And a lot of people don't realize that. Also differences in genetics, obviously. But these differences, what they equate to is different health risks, different health needs, different dietary needs, and different dietary requirements for the two genders. So men and women have specific needs then for their biological being, if you will, but also for their psychological being. And of course, we have researchers who still argue among themselves whether it's the thought first that changes the body or the body that changes the thought, or who cares? The point here is that there are psychological needs and psychological support that's required for females and different support that's required for males, which I talked about a little bit in a previous presentation for you. So genetics does play a very big role. In fact, scientists now believe that at least, I know this is going to shock some of you, but at least 50% of our behavior is actually driven by our genetics. Now, I hope it's not too much more than that, but that's what the research shows us so far. So there are certain behaviors which are genetically programmed into us, and we see that translating by gender as well. Again, this doesn't mean that you can't modify a behavior. There are behaviors that can be modified. There are a few that probably can't, but the majority of behaviors can be modified. So I don't want anyone to be depressed or anxious thinking, oh my gosh, I can't change this or that. Yes, most of your behaviors that are unwanted can be changed, and those that are wanted can be improved. So, but just the idea that genetics very definitely does play a factor. And scientists are still working on the Human Genome Project, and now from a different direction. Originally, it was just identify all the genes in the human body, but now they've taken it to the next step. What does this gene do? What does that gene do? So it's pretty interesting stuff. And I try and read a couple of genetic studies every week. I read new studies every day, but I try and portion it out, some for genetics and some for nutrition and some for hormones and so on. And so that I can make an attempt to at least keep up with the science that keeps changing for us. So your biology affects you in unique ways. And this is why there are certain things that affect women more, certain things that affect men more. And this is important so that when you're aware of this, that you're doing the right thing to give the support that you need, not that someone else needs, but that you need. Too many people put all the differences in men and women based on the reproductive system. And the reproductive system does play a very big role. But folks, it's not the whole thing. It's much bigger than that. As I say, there are many differences between males and females, which have no direct relationship to the reproductive system at all. So let's not put everything on the ovaries, okay? Because that's simply not accurate. It's not good science. So let's talk about some of these health differences very quickly. This also tends to surprise some people. And maybe the first surprise is that the number one cause of death in women is heart disease. Well, throughout the 20th century and now going into the 21st century, people have traditionally associated heart disease more with males than females. But in fact, heart disease is the number one killer of women. And I'm going to tell you a little bit about why that is in just a few moments. Another thing that's very, very big is stroke, because stroke is far more common in women than in men. Obviously, both genders have strokes, but it's more common in women, and it has to do with their circulatory issues. Men, on average, all things being equal, tend to have healthier, stronger circulatory systems than females do. Females, as any of you know who are female, of course, you've probably experienced the whole thing with body temperature, right? Especially if we have females who happen to be married with a male, or they have a male significant other, however we're supposed to say it these days. Sorry, I'm behind on some of that stuff, but understanding that males, the body temperature tends to run higher normally. Females, it tends to run lower normally. So we frequently have the argument in a male-female relationship, an argument over the thermostat. She wants it warmer, he wants it cooler. That's pretty normal. And you'll find that in basically every genetic group around the planet. And this has a lot to do with circulation. It has a lot to do with metabolism. It has some to do with estrogen and testosterone as well. We won't get into that into too deep a detail for this morning's presentation. Well, here's something that you may not know, and that is women have a very strong advantage being estrogen primary, because estrogen actually helps to lower cholesterol and protect from heart disease. Now, I know what you're thinking. You're thinking, yeah, but you said that heart disease is the #1 killer of women. Well, it is, but let's get this in proper perspective. After a woman goes through menopause, the estrogen drops. Now she's at risk of heart disease and stroke and high blood pressure. But while the estrogen is normal, she is at much lower risk of all three of those things. So that's where the difference comes in. That's where estrogen makes the big difference here. Males being testosterone primary, testosterone tends to contribute to heart disease and to stroke, but men have a reduction in testosterone that starts around the age of 40 and tends to drop by a small percentage each year until about the age of 50. And then after 50, it begins to drop very significantly in men. And that's when the male risk goes up significantly. So if you were to make a bar chart or graph, and if you made a graph, then you would see that the numbers of these diseases correspond to either the rise or the drop of either estrogen or testosterone. So in that respect, the hormones play a very, very big role, obviously, in a number of critical issues. Also, women tend to suffer more, and I probably have that more than once in this presentation. Women tend to suffer more with illness than men do in general. And here's an example. When women have blood sugar, which is above normal and classified as type 2 diabetes or type 1 diabetes, what we'll find is that women tend to have a 4 times greater probability of heart disease if they have high blood sugar than men do. And women also have much higher complications with high blood sugar. So both men and women can develop diabetic blindness, kidney stones, and so on. But women have a much higher rate of those complications, all things being equal. So if we're doing a male and a female with the same blood sugar levels for the same period of time, she will be 4 times more likely to have one of these problems than the male in the same comparison. So hopefully I said that clearly for everyone. So women do have a lot of problems which are unique to them and serious for them. It's not just about all of those awful symptoms that are associated with their menstrual cycle and menopause and so on. It's much greater than that. It's much more than that. Women also have approximately 3% of any population of pregnant women will be subject to gestational diabetes. And sometimes that becomes so severe that medication is required, even insulin injection sometimes. So this is another risk for women, obviously, that males don't have. Now, women are far more likely to develop brain-related disorders. This is a pretty important discussion. Right now we're seeing increases around the globe of various forms of dementia, Alzheimer's, and as the studies continue, what we're seeing is that a lot of what everyone spoke of in absolutes as, well, this is the cause and this is true, even as early as maybe a year ago, we still had a lot of researchers saying things like, oh, well, it's this plaque that you form in your brain, and the plaque is formed from this or that. Well, it turns out that that's not true. It turns out that that information was not correct. Even so, the majority of physicians on planet Earth are still receiving the out-of-date information. There's nothing I can do about contacting every physician on the planet and making sure that they all know. I can't help with that, okay? But what I want you to understand is that there are a lot of physicians who are very smart, very capable, and very caring who don't know this information. So it's important for you to know that the most recent study, and this really caught my attention when this came out, because I said I read at least 2 new scientific studies every day, and that's 7 days a week, by the way, folks, in order to try and keep up with the changes, because the science is moving so fast. Nobody can keep up with it. It's just moving too fast. So if your doctor doesn't know some of this information I'm telling you, don't be mad at your doctor, right? You can't expect everybody to devote their life to studying science all day, 7 days a week. I mean, you can't do it. It's not reasonable, okay? And it's not like, oh, there's only one change this year. I mean, there's thousands of papers being published, thousands. So back on track. This most recent study showed a very clear very clear. I even hesitate to use the word association because the evidence was so strong in the study that excess calcium that's getting into the brain is, and I'll use the terms from the study, is strongly associated with an increase in dementia in females, not in males, but in females. Now, I find this very interesting. So I started doing some more study on this, and I started looking at quite a number of new calcium studies, because we've all heard the statement, women need more calcium. Well, what I can tell you is that statement is not accurate. I'll give you a little more detail later on. So just remember, women need more calcium actually isn't really true. It's not accurate. Now, women do need more calcium at a particular time, but again, I'll give you more on that in a little bit. The point here is women are consuming calcium because they're being told that women need more calcium. And if they don't have the required nutrients to break down the calcium, what's it going to do? It's going to cause health problems. That's what it's going to do. So we're going to come back to calcium in a few minutes. But right now, what I want to do is to make sure that we do this for everybody. A lot of people have the misconception that dietary supplements are medicines. Folks, they're not. They're just not. Dietary supplements, as the name implied, are supplements. They are meant to supplement what may not be available in your diet, or you may not choose to consume in your diet. However that pans out, the point is that dietary supplements are not medicines. Now, at the same time, you need certain nutrients, and scientific study, as I've talked about for this group before, scientific study, human blood studies, strongly supports the fact that people today, people consuming the modern diet, not our ancestors, that's a whole different group of people. But today, people consuming the so-called modern diet are not getting sufficient nutrients. In fact, they're not getting sufficient nutrients in a number of very important categories. Once again, your physician probably does not know this. Medical schools around the world pretty much follow the same format. And there's very rare exceptions. There's a rare school here and there, but generally speaking, it is if the patient eats a good diet, that's all they need. And if they suddenly need drugs or surgery, oh, well, that was something different, didn't have anything to do with nutritional support. Well, folks, I beg to differ. It has a lot to do with nutritional support. So this is a whole picture that we have to look at. So it's not about, well, there's medicine and there's nutrition and there's diet. This should be one whole picture. Your body requires certain nutrients to be well. There's no way around this. The science is very, very clear. This is not something to debate or argue about. There is no argument. The body needs certain nutrients, and females need certain nutrients higher than males. Males need certain nutrients higher than females. So we have, as we spoke about during Men's Health Week, there are 9 nutrients that men require in higher amounts than females. There are 2 nutrients that females require in higher amounts than males. We could say 3 during certain periods of time, okay? And I'll explain that to you in a few moments. But what I need you to understand, number one, your physician is an expert in medicine, pharmaceuticals, invasive procedures, medical diagnostics. That's what he or she knows. What they are not trained in is nutrition. And as I like to say, you don't hire a plumber to fix your roof. They both work on your house, but they have different areas of specialty. Hopefully that makes sense for everybody. So if your doctor makes a recommendation for you for a certain medication, well, you make sure that you follow doctor's orders, all right? But understand that your physician almost certainly does not understand nutrition and nutritional needs very well. Well, in the beginning, it's really all about biology. But as time progresses, as we grow older, as we become more of who we are as adults, psychology plays a really big role in our health, because what you think does affect how you feel, and what you think and how you react to stress and how you react to trauma. And if you worry too much, and if you can't get to sleep at night because you're worrying, there's all kinds of connections here. But psychology very definitely affects your physical health and very definitely your immune system. In fact, we're finding out that psychology actually affects your probiotic balance in your gut as well. That's a whole different discussion. So psychology does play a major role in your health. There's no question about it. In the United States, and I'm not sure if this is the case in Australasia, but in the United States, there are at least, and I'm sure there's more than this, but there are at least 38 different disciplines in psychology. So it's not all, clinical psychology, laid on the couch and tell me what you think about your problems. That's one branch of psychology. But there's a whole branch of psychology called health psychology. And that's kind of like a psychologist and a naturopath combined. Okay, so I'm not sure if those exist in Australasia or not, but in the United States, that's one common way to deal with health issues, to see a person as a whole human being, body, mind, and I would say spirit, because our spiritual self is important to our health as well. Generally speaking, so we're talking about psychology right now, generally speaking, women tend to be proactive about their health. It's pretty rare that women are not proactive about their health. Women tend to be seeking answers for health for themselves and the people they love. Men, on the other hand, unfortunately, tend to be reactive about their health. They wait until they're sick. They wait until they have a pain. They wait until they're often double over in pain before they will say, okay, I'll talk to a physician now. Okay. So that's a pretty important aspect of psychology right there. Well, overall, as I mentioned previously, women do tend to suffer more with health issues than men do on average, but the exchange is women live longer, so suffer more but live longer. I think it'd be a lot better to suffer less and live longer. And you might be able to do that if you're giving your body everything it requires. And we go back to nutritional supplements, because diet just isn't providing everything that everyone needs in today's world. Some of you may remember in a presentation I did where I made the The analogy with cars driving on a level road, getting the best fuel economy versus cars driving up a hill, getting the worst fuel economy. Well, our ancestors were driving on level roads for their fuel, that was food and nutrition. But in the 21st century, we are driving on a hill, and that hill is getting steeper and steeper and steeper every year. Psychological stress burns up vitamins. Physical stress burns up nutrition. Nutrition is a fuel. So think of your body, this is the way I think of the human body. Think of your body as an organic machine. I wrote about that in 2004. And all machines require fuel. The fuel is nutrition. And the more stress you put on your machine, the more fuel it demands. If you don't give it the fuel it demands and you keep stressing the machine will break down. It's pretty simple. It's a very, very simple way to look at it. Well, let's do a comparison with body mass and body composition. Now, we did this during the Men's Health Week presentation as well, because this slide is obviously the same, right? But to point out that these physical differences between men and women, to a very large extent, dictate the nutrition that they need to be taking. So you're looking here when we talk about body mass, body composition, we are looking at having much more mass and especially much more muscle mass for males than for females. Again, all things being equal, if you were to get a male and a female who were the same amount of kilos on the scale, the male would still have far more muscle mass than she did, because that's the way we are set up genetically, okay? Now, where do women have an advantage? For reasons that science doesn't understand yet, women are much more efficient at extracting oxygen from their blood than men are, which makes women more aerobically efficient than men. Now, again, we don't have enough studies in that area to really understand why that is, but obviously having a better aerobic advantage, all things being equal, from the starting line, that is a significant advantage for females. Now, this is the part that makes the ladies very unhappy, and I sympathize. I wish I could say I empathize, but I'm a guy, so I can't. But I do sympathize, because the male body requires protein to make muscle mass. It's a requirement. As long as the man's testosterone is at normal level, and some men a little too high, and those men tend to be very aggressive and so on. But as long as this is at normal level, the testosterone, men have this requirement for protein intake because muscles are made of protein. Women, unfortunately, because of their estrogen balance, have a greater need for fat. And ever since the zero fat craze started decades ago, I always had problems with some percentage of female patients who will, I want to be like Twiggy. I don't know how many of you remember Twiggy all those years ago. And I want to be thinner and I want to have zero body fat. Well, that's really the worst thing for a female to do. Zero body fat is a very bad idea. For women, it will adversely affect your health, because the studies show us what you're looking at on the screen right now. Women do attract fat. Estrogen attracts fat, which is one of the reasons that women have a much harder time losing body fat than men do, again, all things being equal. And estrogen needs fat. And so, unfortunately, ladies, that's something that's genetic, and that one won't go away. What about protein and fiber and the daily calories? Well, fiber, men need more fiber than women, and significantly more. Protein, men need more than women, and that's for the muscle mass. Calories, interesting. Depending on how sedentary a person is, that depends on that tells us how many calories you'll need. But the numbers you're looking at on the screen right now have a comparison between older and young sedentary men at about 2,000 calories, the rest of the male population at about 3,000 calories a day. Women generally need to be somewhere in the area of 1,600 to 2,400, again, depending on age and activity level, because activity tells us how much calorie we need to burn. The calorie is the ultimate translation of fuel. So you might, going back to my car analogy, you might think of food as petroleum and the end product being calories or fuel at the pump. So calories is what finally drives the engine, okay? How much do I take? Well, before Manitech existed, in my practice, this was one of the three most common questions I ever got from a patient. And then after I started supporting Manitech, it became one of the three most common questions in Manitech, because it's one of the three most common questions for anybody looking at nutritional supplements for their health. And the questions are, what do I take? How much do I take? And how long will it take? I've always been frustrated with these questions. People are thinking about supplements as though they are medication. So let's say you have a bacterial infection, you go to see your physician, and your physician will say, oh, you have an infection, no problem, take this antibiotic, 500 milligram capsule twice a day for 10 days. That's what people want. That's what they want to hear. And because they want that certainty that whatever you recommend, first of all, is going to fix them, whatever their problem is. And it's going to fix them in a certain amount at a certain time. That's human psychology. That's normal human psychology. And it's universal. But it's a problem because, well, with nutrients, you really can't make that prediction. Now, body size, and we get this all the time with people who have heard something about the use of body weight or body size in terms of determining how much vitamin they should take or mineral or whatever. And they think it translates to all nutrients, but it doesn't. It is pretty accurate for vitamins. It's reasonably accurate for minerals, but that's where it stops. For phytonutrients, that is nutrients from plants that are antioxidant nutrients, very good for your body, necessary for your body. In fact, the reason for eating vegetables and fruits, I say vegetables first, because you should be eating far more vegetable than fruit. Now, I know vegetables tend not to be as much fun as fruit because fruit has sugar in it, but you should eat far more vegetable than fruit. So far more, significantly more. In fact, you should be looking at fruit as dessert, not as your primary snack. If you could get yourself accustomed to using, let's say, broccoli or cauliflower as snack food, it would be a lot better for your health overall. Most people won't do that, which is why we and other companies have created green drinks. We have superfoods, greens and reds, which I'll talk a little bit about as we progress. But those are the phytonutrients. So phytonutrients are not vitamins, they're not minerals, they're not glycans, they're not amino acids, they're their own group of nutrients. And they are the reason that you are supposed to be consuming vegetables and fruits. And of course, there's glycans, and glycans are what Manitech is famous for. Manitech is the world leader in glycan technology. We are the world leader of all of the companies in nutrition. We are the leader in glycan research. Now, some of you are saying, what the heck's a glycan? All right, the term glyconutrient has been used by Manitechers since 1996 because Manitech invented the word in 1996. But glyconutrients is a commercial term. It's not a real term. It doesn't describe anything that a scientist recognizes. If you study the science of glycobiology, what you're studying are glycans. Now, for our purposes, a glyconutrient and glycan means the same thing, all right? But I just want you to understand that I'm going to be accurate and use the word glycan in all my presentations, and I will give some explanation like this in each of those presentations so everyone can sort of put it together, all right? So a glycan is a complex sugar, but not a table sugar. Table sugars are disaccharide sugars. I'm talking about monosaccharides, polysaccharides, and oligosaccharides. And yes, the word saccharide means sugar, but understand that we at Manitech have done a human double-blind placebo-controlled study. Human blood was drawn to test and see if our glycan products, known as ambrotose, would raise blood sugar. And in fact, there was not one patient, not one, in the entire study who had a change in blood sugar when using our glycan complex, known as ambrotose complex, okay? So it's not that kind of a sugar, don't worry about it. But do know this, glycans are foundational to your health, male or female. They are foundational to your health. Now, they are currently listed in the textbooks as necessary sugars. They are not listed as essential sugars. What's the difference? In science, a nutrient which is called essential is a nutrient your body is incapable of making itself. Whereas a nutrient that is known as necessary is a nutrient that the body is at least partially capable of making. So glycans are classified as necessary, whereas vitamin C, as an example, is called essential because the human body can't make vitamin C under any conditions, under any circumstances. You must have essential nutrients daily, especially water-soluble ones like vitamin C. You must have it daily, or you will slowly begin to suffer the consequences of not having that support on a daily basis. Your body can't make it. But what about glycans then? There are at least 13, and I say at least, but there are at least 13 health issues that are known to be caused by congenital defects of glycosylation. What does that mean? Glycosylation is fairly simple. So we talk about cellular communication a lot, and that is with something called glycoprotein. So let's assume that my left hand, my left fist, if you will, is a glycan. And on the right, I have a protein which is coming to meet it. When the two of them meet, you now have them bond together. They become a glycoprotein. On the surface of all of your cells, you have things called receptor sites, which it's not been updated in the textbooks anywhere, but it should be, because they're not receptor sites, they're transceiver sites. They receive and send signals. Okay, so they're really transceivers. But you have a massive forest of these things, thicker and denser than the Amazon jungle. You've never seen anything like it before under a microscope. It's phenomenal how dense these receptors are. And each of these receptors has a little spot on it that's looking for a particular glycoprotein. All right, so let's say that now my left arm is a receptor on top of a cell. And in my right hand, this is the glycoprotein looking for its home. It finds the receptor site and it coats or bonds to the receptor site. When it does that, it has glycosylated the site. So when we talk about glycosylation, that's what we're talking about. And glycosylation, unless that occurs, your body cannot function the way it's designed to function. So if there is a problem in your body, which is genetic, and it keeps you from glycosylating, That's called a CDG, or a congenital defect of glycosylation. There's at least 13 health disorders that have been well studied. I don't think there's going to be more studies because studies are so expensive. And the researchers doing the studies were hoping to make a synthetic drug that they could replace natural glycans from plants with, but all of their studies failed, and billions were spent, US dollars, billions. So we're talking serious dollars here. And they failed, and they failed, and they failed. There's something peculiar to the natural molecule of glycan that simply can't be duplicated, at least not yet. So with this in mind, they've dropped the study. But what we know is that there are at least 13 different areas where people can't convert their glycans as they teach physicians in medical school. Physicians are taught something called the glucose-only theory. And basically what that means is that as long as you have glucose in your bloodstream, so blood sugar, that will always interact with the right enzyme, and it will always make sure that you have the glycans you need. And sorry, that's simply not true. Okay. So anyway, probably something else your physician doesn't know. So in science, we try to avoid absolutes as much as possible. I have been saying this from my very first lecture I did for Manatech, seems like 1,000 years ago. But people naturally want to think in absolutes because thinking in absolutes gives us certainty. It makes us feel secure, and it allows us to move on and think about things that are more fun. The problem is in science, absolutes are almost never used because they're almost never right. So the calcium myth, I told you I'd get back to it, so here we are. The calcium myth, women need more calcium. Well, yeah, between the ages of 50 and 71. Oh, I thought it was all the time. No, it's not all the time. It's just between the ages of 50 and 71. Why is that? Because the estrogen changes at this point. It's around the age of 50, and for some women, it's a little later. For some, it's a little earlier. But in the textbooks, they generally rate it as 50, okay? Now, when the estrogen goes down, now she has a number of different issues related to calcium metabolism. So during that period of time, 50 to 71, women do need more calcium. Before 50, they do not need more calcium. And taking extra calcium is potentially hazardous to your health if you can't break that calcium down. So the absolute of, oh, I should always take more calcium because I'm a woman. No, it's not right. Please don't do that. Please be well. Please be healthy. Use the information that you're being given here. Don't be foolish, okay? Well, it's around the age of 71 that the male system begins to break down to the point where the male now needs the same level of calcium as the female. So there's the accuracy, there's the truth of it all. Now, it seems that according to another study that was done fairly recently, calcium deficiencies are really rare. In fact, calcium is very high in the modern diet. Modern diet's quite rich in calcium. But what it's not rich in is vitamin D and magnesium. If you don't have enough magnesium, you are not going to break down that calcium. If you don't have enough vitamin D, you are not going to transport that calcium. It's not going to happen. So if you're taking an extra calcium all the time, thinking, well, you're a woman, so you need more, you might be causing yourself some negative situations in the future. And that could be related to kidney stones. It could be related to calcification of the arteries. It could be related to brain health as well. Magnesium and vitamin D. Well, what do we know about those two nutrients? There has been test after test after test. Now, these are random studies showing that most people tested don't get enough magnesium. And most people being tested don't get enough vitamin D. But as many as 40% of people in some countries get too much too much calcium. So folks, don't think in absolutes, all right? There are times when more calcium is a good thing for a woman, but it's not every day of her life. Please don't do that, all right? I don't want you to have calcification. I don't want you to have the potential, as this most recent study indicates, for early onset of pretty serious problems with the brain. So, and there'll be more studies, and as they come out, we'll incorporate them into new presentations. What about iron? Well, we hear all the time, women need more iron. Well, they do between the ages of 19 and 50, but not before 19 or after 50. At that point, men and women have the same requirements, essentially. Now, that will vary a little bit based on genetics, and it also varies a little bit based on activity. But basically, women need more iron between the ages of 19 and 50 only. And if a woman needs more iron, if she has a bona fide blood diagnosis that she is iron anemic, she needs to be under a physician's care, which is why I always recommend against putting iron in a multivitamin to any significant level, because it's one of the few nutrients which is actually known to be toxic. You can have a toxic buildup of it. So hopefully that'll explain a few things. Folate is another one of those nutrients that's very much associated with females, although men and women certainly need folate. Folate is vitamin B9, and B9 can be found in either the natural form or the synthetic form, like most vitamins can. But the absolute statement that people love is synthetics are always bad and natural is always good. Well, that's not true. And here's an example. This would be prenatals. In scientific study, what has been confirmed, there's a type of birth defect called a neural tube defect. If a woman gets sufficient folic acid, yes, the synthetic one, prior, or I should say during her pregnancy, the probability of a neural tube defect in her child is extremely low, maybe zero. But folate won't do that. But we don't actually know for sure why that is. Normally, I recommend folate, the natural plant source of vitamin B9, because in most cases, folate is superior to folic acid. But here's a case where it's not. And just so you know that the absolutes make me crazy when people get all sort of pigeonholed into that. This is always this is always that. Well, in science, it's typically not the way it works. So in the psychological differences, this is important too. We know that this does have a significant degree to do with both estrogen and testosterone in men and women respectively. And what we know is that women, according to psychological studies, tend to suffer more with anxiety and depression. But men tend to commit suicide when depressed more frequently than women do. And of course, men are also more prone to antisocial disorders, aggressive behavior, unfortunately, and substance abuse than are women. Now, there is one area of substance abuse where men and women are the same, and that's in amphetamines, in stimulants, which I think is interesting. More study is needed, as they say. So these are some of the psychological factors. Well, let's talk about some products. Now, it may not surprise you too much if you're a Manatech associate, the products that I'm recommending. And I'll give you a little bit about why I'm recommending these, but just at a glance, here you go. You can see what I would recommend for both men and women, and wow, it's the same. But it's for different reasons. So we had an article published in the Journal of the American Medical Association where they did blood testing, and they found that almost no human being in the test got enough vitamin from diet alone. So they said everyone should be taking a vitamin supplement. Catalyst is our best, our strongest vitamin supplement. It's also our most, I would say, scientifically tweaked, because we tweak it fairly often as the studies are moving around for us. So it provides you the basics that you need for metabolism and antioxidants and healthy tissue and your sense of well-being and growth and bone health and gastrointestinal health, immune health, all those things. Everybody needs vitamins and minerals every day. Everybody, no exception, everybody should be taking Catalyst every day. And yes, I did just speak in an absolute. Now, I'm also very strongly recommending our superfood greens and reds. Here's your source of nutrition from the vegetables and fruits that you should be eating a lot more of and probably are not eating enough of, according to studies that we've seen in various countries. So for your phytonutrients that you get from vegetables and fruits, superfoods, greens and reds. And this actually tastes good too. Most of your green drinks are awful. I mean, they just taste so awful. But this tastes good and it's super nutritious. It really is a superfood. Now, endocrine support or glandular support or hormonal support, however you wish to describe it. Most people, when you say women's health, the very first thing they say, and maybe the only thing they talk about, is the reproductive system and estrogen. And of course, estrogen, as I mentioned, does play a very big role, very key role. Our most successful product worldwide over the years has been Plus. And I say most successful because no matter what product we launch, Plus is always in the top 5. It's always in the top 5, and I almost never train on it because it makes you feel good so fast that when your bottle is empty, you want to buy another bottle. And most people don't even care why it works. They just know it works and they don't want to give it up. So the claims that you have in Australia, every country has different claims. And that's about regulations. It's not about science. So with this in mind, the claims you have in Australasia are good. They're what you see in front of you right now. I took this directly from your website. And you see it's alluding to menstrual spasms and cramps. So it must have something to do with endocrine support, right? Well, let's expand upon that a little bit. Your glands need certain fuel, just like your total body as a machine. Each of your glands is a machine subcomponent of your big machine, okay? Those machines all need fuel. Part of the fuel they need is vitamin. Part of the fuel they need is omega-3. And a huge part of the fuel that they need, also mineral, mustn't forget that. And a huge part of the fuel that they need are what are called phytosterols or plant sterols. The fossil record and studies of hunter-gatherer tribes indicate that our ancestors were probably eating plant sterols on a pretty regular basis. Plant sterols don't taste good, folks. I mean, they do not taste good. But hunter-gatherers have to survive. They're not looking for the best tasting chocolate bar they can find. They're looking for food to survive, right? Well, we don't eat things that don't taste good. I mean, it's pretty rare that a person eats things that don't taste good. So you really can't go to your supermarket and get yourself some Mexican wild yam. It's just not there. Well, that's one of the sources for important endocrine support that helps your glands make the hormones you require. So it's not a hormone by itself. That is inaccurate. It's been said so many times by associates, and it's just not true. Okay. So Plus does not contain hormones. plus contains the fuel that helps your glands make your hormones. That's the way it works. That phytosterol has to work in conjunction with certain vitamins, certain minerals, and omega-3. If all those are together, all those fuels are together, then your glands can make the hormones you need. Then how do your glands know how much hormone to make, when to stop making the hormone, what type of hormone to make? They know this from cell to cell communication, and that has to do with glycans. And that, of course, is ambrotose. Hopefully this is all coming together for you. So phytosterols then help to support your metabolism, your energy, growth, obviously, and development, sexual function, reproduction. We've seen much with that. Heart rate, blood pressure, appetite can be affected by the hormones as well. How you sleep at night has a lot to do with your hormone balance during the day. And of course, the whole body temperature thing that we talked about a little bit earlier. So Plus is a proprietary blend of phytosterols, plant sterols. It's not a hormone, okay? And so everybody who's, oh, my doctor is afraid of this because it's got a hormone in it. It does not have a hormone in it. It's not a hormone. Now you have to be careful with the claims from one country to another because the claims are different. But this is a training that we're doing. This is not an advertising or recruiting seminar. This is training. So I want you to understand that one of the claims that we have in the United States, one of the approved claims is that Plus supports breast health. Now, we wouldn't have that claim if it was a dangerous hormone, would we? Because it's not a hormone, all right? So people need to quit saying that. It's a phytosterol. It is a food that helps your glands make the hormones you need, okay? And then last, but as the saying goes, certainly not least, the gut microbiome. Now, your body has 3 microbiomes. It has a gut microbiome that everyone knows about, I think. It has a skin microbiome. It also has an oral microbiome. We don't have time to talk about that in this presentation. But it's pretty interesting stuff, the oral microbiome, because in the oral microbiome, glycans are key to a healthy mouth and healthy teeth and healthy gums. And that's not something I've actually ever trained on for associates before. I've trained doctors on it, and I've trained dentists on it, but not for associates. So we know the basics, that about 70% of our total immune system originates in the gut, in your digestive tract. And obviously this affects your total immune system all over your body. But we know more about this now. One of the things that we know is that, and this is from some genetic studies. In fact, I read a fascinating genetic study on this, where scientists were studying the genes of those tiny little probiotic organisms and studying the genes of certain brain cells to see if there was communication. And guess what? The probiotics in your gut are talking to certain brain cells. And this affects your behavior. It can actually affect depression. It can affect your mood. It can affect your sense of calmness, your sense of worry or anxiety. It can affect those things. Scientists are really studying this hard, trying to really clarify these connections. But these tiny little microbes in your gut are actually speaking to brain cells, and brain cells are speaking to them. It's fascinating stuff, fascinating. So what do we know then? We know that ambrotose technologies, and I say that as a plural because in different countries we have as many as 3 ambrotose technologies, but ambrotose complex, ambrotose life, and in some countries advanced ambrotose as well. These all, the base formula is the same in all 3 products. There's minor tweaks to all 3 of them, but the base formula is ambrotose complex for all 3 formulas. And Manipul is the key ingredient in that. We know that Ambertose Technologies and Manipul improve your gut health. We know that they are prebiotics that not only feed the probiotics, but in the process, and I love this, science is beautiful. So in the process of breaking down the glycans into a form that can be used in your bloodstream for glycosylation, they have to interact with the probiotics. That's how they break down. And when they do that, they're actually feeding the probiotics, making the probiotics healthier, and allowing the probiotics to colonize more efficiently and make you healthier. It's science is a beautiful thing, just beautiful. Well, here are the products that you have in Australasia. I know that at least I think these are the right containers. I hope. We got so many products and so many, we're in 32 countries now. So many containers. Anyway, I believe these are the correct containers you have for Australasia. And so Ambertose plus AO, I didn't talk too much about antioxidants. Estrogen favors the fight against oxidative stress. Testosterone makes it worse. So yes, you could make the case that up through the age of 50, men need more antioxidant support than women. But after the age of 50, men and women need the same level of support. Okay, so AO plus Catalyst, GI Pro Balance, Ambertose, and yeah, Ambertose Complex is the one I personally use as well. And superfoods, greens and reds. So that's our presentation for Women's Health Week. I hope you learned a lot during this. And I'm going to give the screen back to Sharon.
What a treasure trove of education, Dr. Nugent. That was awesome. There is a few questions. Do you mind a bit longer?
That's fine. Go ahead.
Some I don't think that you can answer, but if someone does has concerns that they have too much calcium, is there any way to reverse that?
Yes, more magnesium and vitamin D. Magnesium would be the key because magnesium breaks down calcium very fast. Now, it's important that you use a form of magnesium that will actually do that because dietary supplements come in a myriad of magnesiums. And the one which is purchased most frequently is the wrong one. And that would be magnesium citrate, or probably in Australasia, it would be pronounced magnesium citrate, I suppose. But magnesium citrate or citrate is used to loosen your bowel. In fact, that's what they use in large concentrations to prep you for a colonoscopy, to clean you out, right? Now, that is not going to help you break down the calcium in your blood. So you want to use magnesium in the form of either a glycinate or a gluconate. One of those two forms of magnesium will do a very nice job breaking down the calcium.
Awesome.
And of course, vitamin D is very, very key.
And can you take too many plus in a day?
Don't know how to answer that because we have observed, we have not studied, but we have observed people going as high as 12 a day with no adverse effects, but that's not a study. And so, you know, we're a public company and I need to be careful here. And plus the fact that I'm under new orders where I'm not permitted to make recommendations that exceed the label recommended amount. So I probably answered the question the wrong way. I probably shouldn't answer it that way.
No, that's a really good answer, Dr. Nugent. And this has been a question asked forever, but is there any possibility of us ever getting the US version of Plus?
That's up to TGA. Listen,
yeah, it's regulatory issues.
There is nothing I would rather do, and I know that senior management would support me across the board. There's nothing I'd rather do than put all the US products in every single market on planet Earth. But the regulatory bodies in each country have peculiar things that, and as I mentioned earlier, it's not about science. It's not about science at all. And why do they, I don't know why I shouldn't I shouldn't go there. I'll get myself in trouble. But
Yeah, TGA and APRA, don't get me started.
yeah.
They're not our friend, put it that way, even though they pretend to be. Dr. Nugent, God bless you. And thank you to everybody who's here today. What an awesome in-depth education for us. I'm really appreciative.
All right. Good
Thank
deal.
you.
I was glad to
And
do
watch.
it.
Oh yeah, thank you, Dr. Nugent. So watch your emails for next week. It's not finalized yet. And thank you for being here, everyone. We'll see you next week. Same time, same place.